Today we will talk about an important topic, that is BPH. BPH. This is seen only in elderly males. Elderly males. It's not a female problem. It's only seen in elderly males. Benign prostatic hyperplasia or hypertrophy. BPH, benign prostatic hyperplasia or hypertrophy. This is the diagram, you can see it. This is the left kidney, this is the right kidney. These are the ureters. Urine forms here, urine comes through this. This is the bladder, which is in the lower abdomen. We will get some pain when we are about to go to toilet. That is the thing. So this is the bladder where urine stagnates, and when the urine is coming out through the tube outside, when you are passing, this is the gland. This is called prostate. This is called prostate. This particular small one is called prostate. These are seminal vesicles, forget about it. So this is the prostate. So what is the importance of prostate? Why prostate is important? Why is prostate is there? To form the semen, three things are important. See, sperms are formed in the testicles. Sperms are formed in the testicles. And the fluid around the sperms is formed by prostate. That fluid comes from prostate and seminal vesicles. All the three mixed, it causes semen comes out. Otherwise, only sperms cannot survive. It has to survive in the fluid. The fluid is formed by prostatic fluid and seminal vesicles fluid. These are all the things. So all the three are important. Seminal vesicles we are not discussing now. We are talking about this prostate gland. As the age is advancing, as you are retiring around 60, you cross 50 or you have come to 60, this gland enlarges. Usually it is the size of a nimbu, a small lemon, but it increases to the size of almost a small coconut. So usually walnut size, it becomes a coconut. So as the age is advancing, this slowly enlarges. When it enlarges, it compresses the urinary tube, that urethra. It compresses the urethra. So the flow of urine becomes very narrow stream, and sometimes it can be drop wise, or sometimes there can be a frequency, more number of times you have to go to the toilet, or you may completely, urine may completely stop, and you may suffer. Urgently you have to go to the urologist. So what is the treatment? What are the treatments? Basically, this is not a dangerous condition. This is a very, very, very benign condition. It is not harmful, but it is troublesome. But at the same time, prostate can develop cancer also, not because of this, not because of BPH. Prostate in elderly people can land up in cancer also. Prostatic cancer is also very, very common. So what we have to do is get an ultrasound abdomen. Simple ultrasound scanning of the abdomen will tell you which grade the prostate is. Grade 1, grade 2, grade 3, grade 4. That size of the prostate will be it is very, very significant. Okay, and one more test, PSA, prostatic specific antigen. If it is 4, nothing to worry. It is little elevated. It gets elevated even in when there is prostate infection, urinary tract infections, it gets little elevated. But it is grossly elevated in prostatic cancer. It is grossly elevated, like 40, 80. We see very high PSA levels. You should consult you have to consult a urologist if the PSA levels are too high, 10 times, 20 times, like that. So if the PSA levels are very high, you have to consult a urologist to rule out a cancer, of the prostate. They will do a biopsy and then tell you. They will take a small piece, test for any cancer tissue and all. Okay, and the treatment follows like any other cancer. And there are some medicines for BPH. There are some medicines for this benign prostatic hypertrophy, which is not dangerous. Okay, so only thing is it is troublesome. Flomax, tamsulosin is one medicine. Flomax, that is tamsulosin, 0.4 milligrams to 0.8 milligrams is one medicine which relaxes this urinary bladder and the urethra so that the flow increases. And another medicine is dutasteride, finasteride or dutasteride, which is very well, finasteride or dutasteride. This also increases the flow by reducing this prostate gland size, by reducing the prostatic gland size, but these are temporary. In market you have Flomax tablets, and there are medicines which are combinations of Flomax and tamsulosin with dutasteride. These two combinations are also available in the market. Daily you can take it. This is temporary. But what is the permanent treatment? What is the permanent treatment? TURP surgery, not open surgery, it is a closed surgery, it's a keyhole surgery. They go through the urethra, they go through the urinary orifice, and it is transurethral resection of prostate. Transurethral resection of prostate. That means they will send a tube inside the urethra and they just pluck it out. Totally, they just like you do that coconut, no? Coconut you try to chip off. That is the way they chip off the prostate and bring it out. This is called transurethral resection of prostate. Very important surgery, very small surgery, 1 hour it takes, and 2 days you need to stay in the hospital. And prostatic artery embolization is another technique. That is, the artery which is going to the prostate is blocked, is embolized, so that the prostate size shrinks. This is another technique, but not followed by us. Higher centers follow it. So from our side we are doing only TURP, but you must be cautious most about prostatic cancer. All the people who cross 60 years, once in 6 months, please get PSA checked, prostatic specific antigen blood test. This should be checked once in 6 months so that you can avoid major complications.